Hello, everybody, and welcome back to our Wellness Wellbeing webinar. I think it's hard to believe here we are already in October, but thank you for joining us during your lunch hour. Today, we're talking about 30 and 30 renewal tips. So we are actually taking a spin on wellness. We all know that financial wellness matters just as much as physical wellness, and a lot of your money at this time of year goes towards your benefits. So today I am here with our benefits experts. I'm so excited to introduce you to my colleagues. I have Amber Chittenden and Alia Noel. Do you guys want to give an introduction?
Yeah, I'm Amber Chittenden, the Vice President of Client Engagement, and I work with many of our employers as we are discussing open enrollment and their employees. So I'm really excited today to share with you how you can save money and make the best decisions during open enrollment this year.
Hi, good afternoon. I'm Alia Noel, and I'm an advisor. I'm on the sales team, so really looking forward to sharing some very insightful tips to talk with you about everything from open enrollment to how to use your benefits. So I guess we'll get started.
Yeah, and you guys know my face already, but my name is Sarah Michaels. I'm our Vice President of Kinetiq Health. I have the great privilege of leading our clinical analytics and financial responsibilities at Apex. I work alongside these folks to figure out how can we improve the health of our populations and as a result save our groups a lot of money. So today's super fun because on the agenda what we are going to be discussing is truly open enrollment. A lot of you guys, it's January 1st is coming up. You guys have benefit decisions to be making. And so we're going to give you 30 of our favorite tips. So hold on tight. There's a lot of good information here. And then you'll see some of our faces floating throughout your offices in the near future, I'm sure. And so if you don't catch all of this, have no fear. It's going to be recorded, but we are always available as well. So let's jump right on in with enrollment. What do we need to know, Amber, about open enrollment?
I'd say don't get stuck in the daily grind. This is a very important decision for you to make for yourself and your family. Think about what are your expenses that you typically have every year and what do you anticipate for the next year? Do you have any surgeries that are coming up? Or are there new prescriptions that maybe you think you're going to be put on for this year? So think about all that and don't let competing priorities take you away from making those important decisions. You make this election during open enrollment, but you're stuck with this plan for the next 365 days. So make sure that you take the time to evaluate the plans that are offered and that you're making the best choice for the benefits that are going to cover you the most.
Absolutely.
Also, really comparing cost. So choosing which plan is right for you. And then, we're on enrollment. So the enrollment, if you have a spouse that is also covered by their employer, look at those two different plans. One is their spousal carve out. Sometimes you will find that an employer will not allow you as a spouse to have coverage on the plan. However, if you do have the option of each of those plans, you have to look at what's the cost that's coming out of your paycheck on a per pay basis. Annualize that to see what you're paying for those benefits. And then you also need to look at what's the deductible? What is the out-of-pocket maximum? And think if you're on two different plans and maybe you have a $2,000 deductible on each plan, you essentially now have a $4,000 deductible. Look at what you're paying out of pocket on a monthly basis to then understand, is it really worth the extra $2,000 in deductible for what you're going to be paying for that premium? So again, you go back to school, it's a math equation and understanding what are the actual costs. So making sure that you enroll in the right plan, especially with spouses and children.
Well, I think so often we always look at just what am I paying out of pocket from a contribution standpoint, but I love that you added in looking at the out-of-pocket max. I think that's an area a lot of people don't even think about.
Right, and that out-of-pocket maximum, I always say it's your worst case scenario. So what if you are hospitalized? You have that $50,000 hospital claim that we all hope doesn't happen, but that's the reason we have insurance. So that's why I always look at that out-of-pocket maximum as well.
And you kind of got into it, but deciding which plan is best for you, this is key.
Yes, so typically most employers offer at least two plans. And so if your employer offers two plans, it's always important to understand which is the best plan to choose. And so you do need to look at contributions. Again, what you pay out of your paycheck on a per pay basis. Look at those deductible amounts. Are they embedded, which means that you have an individual deductible embedded within that full family deductible if you have a family. Again, what's that out-of-pocket maximum, that worst case scenario in the event that you and or many of your family members meet that out-of-pocket maximum for the year. Look at your co-payments. When you go to the doctor's office, if you have a co-pay plan, what are the amount of those co-pays? Prescriptions, that's a big one. And a lot of times you may have the prescription benefit that's the same under both of those plan options. So again, do the math, and if you have an HSA plan, make sure you are taking into account if your employer is putting money into that HSA account, that's free money to you, for you and your family to spend on benefits for the year to help reduce your out-of-pocket expenses. So typically you'll see for a plan with a higher deductible, higher out-of-pocket maximums, you in turn pay lower premiums out of your paycheck on a per pay basis. However, if you have a lower deductible, lower out-of-pocket maximum, you're typically going to pay more on a per pay basis. And a lot of times that depends on how you experience benefits as well. If you have a lot of office visits, maybe that deductible doesn't mean as much to you. So again, do the math. That will help you in making sure you enroll in the right plan.
Yeah, and if you're still unsure, I really want to highlight our team here at Apex has that team of clinicians to walk you through those scenarios. So if you're on a high cost medication, maybe you have an upcoming procedure, you're not sure which plan is best for you and your family, feel free to reach out to your clinician directly. We are all assigned to your accounts, and we are here to walk you through those scenarios and tell you exactly what those costs would likely come out to be. Yep. And even if you're on a high deductible plan, there's a lot of cost saving tips. So Leah, let's talk about the medical savings.
Yeah, so make sure if you need to use a provider, you go to an in-network provider that can save you a substantial amount of money, and make sure that each and every time you're going, you're verifying with your insurance carrier that they are in network, because things can change. And just remember that those providers have been credentialed by your insurance company, so they are trusted medical professionals. And also, if you were to go out of network, then you have a chance of being balance billed, which can be a nightmare to try to resolve. So when I say balance billed, I mean the amount between what the provider charged and what the insurance paid. So there's just a lot of benefits to going in network to an in-network provider. Next, let's talk about using ambulatory facilities or freestanding facilities. You'll find oftentimes that if you need a procedure done, that the provider might send you to a hospital. However, there are lower cost and still just as high a quality ambulatory centers or freestanding centers that can save you substantial amounts of money. And that's everything from a surgery, or think about imaging with CT scans, x-rays, and then procedures like that.
We experienced this in my own family. My husband had an injury, went to the specialist. They sent him to the hospital to get an MRI. He called and said, hey, I have to get this MRI done. I'm going to a hospital, get it done. I said, oh no. No, we're not. No, that's going to cost you $2,500 if you go to the hospital. And so I was able to look online for him and show him that it was going to cost $600 out of pocket to go to a freestanding facility. So again, that's the way our family utilized those benefits, to make sure it takes a little bit of research, but to me, saving almost $2,000 was absolutely worth it.
Well, I think sometimes it's where our healthcare is somewhat broken. We have all these major hospital systems that have bought out the primary care providers these days, which is great because it is the convenience. But if you think about where they're referring us, it's typically right back to that hospital setting. And as convenient, you think you need it now and we need to go down that hall to get it done. That's where those bills are coming from. It is okay to say, let me do my research, let me reach out to people, let's figure out the most cost-effective solutions. So we have those for you. Imaging, I'm glad you highlighted that, for sure is where you can save a lot of money, as well as labs. So making sure we don't stay in the hospital setting for those and we go to those ambulatory systems. Kind of on a similar page, choosing the right setting.
Right. So oftentimes you can be experiencing a medical issue and you think, well, let me go to the ER. However, going to the ER is going to cost more. Right. Than going to the place that's most appropriate for the care. So average ER costs, last time I checked, were around $1,600 a visit, and it can be higher than that. That's just the average. So when you think about $1,600 a visit versus going to having telemedicine, for instance, which is oftentimes under $100 a visit, then you're going to save substantially if you think about, okay, where do I need to go?
Yeah, I think COVID really helps with this too, because now telehealth is just available everywhere, even at your primary care physician. So
Yeah.
you know if you're sick, I know if I'm sick. It's sometimes so much easier just calling that script. And
Well, and it saves time from work too. So I love telehealth. I'm able to call. I don't have to drive to the doctor's office. I don't have the extra time I need to take off work. So it's a huge benefit. It's also very important to know.
And so focus on preventive care, very, very important. So think about exams like colonoscopies, mammograms, things like that. And oftentimes, preventive care is covered 100% by your insurance. So you don't even have an out-of-pocket cost for it. So think about that. And mental health as well. I get those mental health exams. That's just as important as physical health.
yeah, it is covered 100%. And as a nurse, this is something near and dear to my heart. Especially coming off of COVID, what I'm starting to see in our claims history is showing is that cancer is being diagnosed so much later at more severe stages than it was pre-COVID. And it's because people were waiting. They were afraid of the healthcare system. This is your call if that's you. You have not gotten your annual exam yet this
Don't
year.
do it.
Don't do it. It's free. I also tell parents when they're struggling with mental health with their youth, the primary care physician is your first stop shop. So go to your primary care. It's the most affordable option, and they've got connections to all of your specialists that you guys need.
Absolutely.
So moving on to pharmacy, one of our favorite topics here at Apex. The reason we have so many pharmacists on site is because there's a lot of savings that you guys can find on the pharmacy side. And let's start with the basics. Use generics whenever possible. Just like when we go get over-the-counter medications, you guys know Alia, Tylenol, Advil, it's going to be more expensive than the store-bought kinds. And if you look at the bottles, the exact same ingredient, right? And so if there's a generic ever available, a generic equivalent, ask your provider when they're writing that script, is there a cheaper option? Same ingredients, treats the same condition, use it, you're gonna save a lot of money on
Well, and some plans may be set up that you pay the difference between the generic and the preferred brand name medication. And so you may not even realize that that's part of your medical plan. So it will save you even more when you're using those generics.
And so maybe you know you're on a specialty medication just by looking at the price tag. A lot of times you know if there's a specialty medication, which means there's probably not a generic equivalent available. You guys might not know that there's manufacturer aid programs available for many of these drugs. And the reason being is manufacturers want to incentivize you as the patient to get on their medication, right?
Yep.
So they're going to throw extra money your way that also impacts your plan costs. And so what we tell people to do is always look it up. You can do a quick Google search, type in the name of your drug, type in manufacturer aid programs. You might be surprised to see that there's funding available for you. If you find funding, you don't know how to apply for it, again, reach out. We have a team of pharmacists that do this every day. You'd be shocked to see maybe a 7,000 medication is actually covered in full because there is grant funding out there. And when we are the first team that we will help support you guys to get on those medication programs.
Actually, I just got a text this morning on
Did
that.
you?
One I'm gonna have you look up here.
There you go. It's something we enjoy. We get to play investigator all day, but it's real money. We know even $500 a month is substantial savings for our employees, and that's what we're about, is helping you guys as caregivers. This is one that's probably my favorite tip that I learned in the benefits industry now, which is compare prices online. Who knew that the CVS and the Walgreens and the Walmarts all had different prices for the exact same medication, but that's the reality we're in today.
Yep.
So you always want to shop to figure out where is the best pharmacy for each medication. And you might have several different locations you're shopping at, but there are apps like GoodRx that if you can actually type in your drug, you can see the cost at just like a pay. So maybe you're on a high deductible health plan. You have already, you know you're not going to hit your out-of-pocket max. So maybe you want to actually cash pay. That's becoming a lot more popular, I think, where if I can find my medication for $5, just going to use my own money to do that.
Yeah, don't run it through insurance. So if you know you're not going to hit your deductible, your out-of-pocket maximum, you're not penalizing yourself, but you're saving yourself money. Another thing that people don't know is Costco. They have a pharmacy. You do not have to be a Costco member. It is against the law for them to require you to have a membership in order to utilize their pharmacy. And so if you see them on that low price list, you can still go in and use their pharmacy. So again, shop around, try to find the lowest prescription. I know we did it. My daughter had an eye drop medication that was over $300 a month. I used GoodRx and I got it for $65. So a great way to save.
And pet lovers, we're gonna blow your minds here, but did you guys know one of the most expensive parts of going to the vet is that script that they write you? Well, tell them to give you that script. Go to your pharmacy, give it in your pet's name. They can actually fill that script for you. You can use these coupons and save 90%. So make sure you're looking at all the GoodRx apps, everything that's available online before you pay out of pocket for those scripts. The last one on the pharmacy is mail order pharmacy drugs. So this is actually applies to people with chronic conditions. Maybe you have high blood pressure, high cholesterol, diabetes, even mental health drugs that you know that you need to take on a continual basis in order to improve your health condition. So this is not going to be, hey, I have strep throat or I have the flu. But these drugs that you need on a monthly basis can go through mail order, which means they're delivered directly to your door. You don't have to wait in line at the pharmacy. For a fraction of the cost, and this really helps with compliance. And if you're a caregiver to elderly parents, make sure you ask about the mail order. It saves you all a lot of time and money.
Yeah, and check with the carrier as well, because there are some medications that are mandated that they be through mail order.
Yeah, absolutely. I think I skipped one, so HRA, I'm gonna throw it to you.
Okay, sure. So HRA, which stands for Health Reimbursement Account, is different from the other accounts in that the employer funds this. So your employer is going to fully fund this for your out-of-pocket expenses. So think about if you haven't met your deductible, co-pays, things like that, and HRA can really help with. And also know how you're going to submit your claims. There are some HRA accounts where it's just an automatic reimbursement. Others where you have to actually submit your claim. So make sure that you know how you're going to be reimbursed and the timelines on that as well, so that you don't lose any money. Next is health savings account. So unlike in HRA, the health savings account is something that the employee and the employer can contribute to. So you want to make sure that you take stock of just the different things that you might have going on throughout the year. So any sort of procedures, imaging, and so you know how much to fund. However, also know that with an HSA, you can carry that over from year to year. So what you're seeing now on the screen is if you're using an HSA, if you're not using an HSA, and the tax benefits of that and the take-home pay.
Yeah, I would say rule of thumb is, if you're in a 25% tax bracket, think about the fact that for every $100 you spend on out-of-pocket medical expenses, if you are using pre-tax dollars instead of post-tax dollars, you're saving $25. So why give that money away? That's something that you can keep in your pocket and make those dollars stretch even further. And it's always a good rule of thumb to continue to deposit money into that HSA, because you can use it for future expenses, but it's there when you need it. And so if you do get that $50,000 claim, and maybe you have a $3,000 deductible and a $6,000 out-of-pocket maximum, if you've been saving over the years and you have that money in that HSA account, it isn't as big of a burden because you're able to use those funds to help for those catastrophic events.
Well, I think you got to the next point, which is just saving for future expenses. It is a savings account. That's what it is.
Absolutely. So and thinking about it that way, not only are you saving for future expenses because it does roll over from year to year, it's also an investment vehicle as well. So think about investment opportunities, and then also saving for retirement. So going beyond just what you think about with medical each year.
Yeah, you have people who are on Medicare now, and they can still use the money that's in that HSA to pay for their expenses during Medicare when that donut hole. It's a great opportunity.
FSA, something that people might know a little bit about, but I feel like this is more unfamiliar than maybe the HSA account.
Correct. So with the flexible spending account, it is definitely a use it or lose it. So make sure that you're not on the latter end of that when you're losing it.
And if you are, there's secrets on what you can buy.
Yes, absolutely. So think about stocking up on OTC, over-the-counter medication. So there are things like that, sunscreen, first aid kits. So just check out what's eligible, because sometimes there will be things on that list that you thought, oh, I didn't know I can purchase this with my FSA. And then for some accounts, there's an FSA card, so you have a credit card, and then also for others, you actually have to reimburse the claim. So know how you're going to get reimbursed with that as well.
So if you don't know how much money is in your account today, go check so that you don't lose it.
There you go. And then go on Amazon, and it's going to tell you what's FSA eligible. So now you can go on a shopping spree. So there's your tip of the day. Let's move over quickly to ancillary, which means all those other fun lines of coverage that you might have available. First one I want to hit on is going to be dental plans. It's a very common one that's paired with your medical plan. So just like medical insurance, dental also has in-network providers. So as Alia mentioned earlier, it's very important that you ask whether or not your dentist is in-network, because that's where you're going to get the greatest, deepest savings to then apply those benefits and really stretch those elsewhere. If you don't know if they're in-network, it's fine. When you're scheduling, not when you show up, but when you schedule, give them your insurance information, have that dentist run it through the plan so there's no surprise billings after the fact. And then one that I really try to explain to people is really understanding your limitations. So there are annual maximums a lot of times on our dental plan, which is actually the opposite of medical. Right. So in medical, when we talk about out-of-pockets maximum, it's me as a plan member, what am I ultimately responsible for? On the dental, when we talk about these limitations, we're actually talking about what's the annual maximum that the plan will pay you. So if it's $1,500, once you exceed that amount, you're actually now responsible for the remainder. So really understanding those limitations.
Yeah, and remember that limitation is a per person limitation. And so if the limit is $1,500, that's per participant who's enrolled in the dental plan too. So it may be you have $1,500, your spouse has $1,500, and your kids.
Yeah, and then for ortho too, there's lifetime maximum, so you have that too. If you have kids that have braces, just know that it's a one-time payout most of the time, as opposed to the annual.
Yeah, and I think that's kind of goes to say, like, which dental plan is right for you. Some of our employer groups, you might have a high dental plan, you might have a low. Maybe the low covers 100% of your preventative care, but that high plan might include that orthodontic. So if you know that you have a child that needs braces, it's super, super important that we're paying attention to which plan we're on. Also, if you have major dental insurance coming up, tell them to run a predetermination of benefits. People don't know what that is. That essentially means they are checking ahead what you would be responsible for paying out of pocket. So you know going into that procedure what you'd be responsible for. Yep. Now let's fly into dental or vision. We're leaving dental, we're moving into vision. Get creative about your benefits. I want to give you a quick tip here. A lot of time, for example, your lenses are covered every single year, but your frames are only covered every other year. Right. Well, if I want a new pair of glasses, all I need to do is take full advantage of those lenses on a yearly basis and pop those into my old frames, and voila, we have some glasses. So be creative, really pay attention to what your vision covers. And then we talked about FSA, HSA earlier, that pre-tax funding, you can use that for vision. So if your plan doesn't cover glasses and lenses in full, go ahead, take advantage of taking out that money, using those pre-tax dollars to offset the cost when it comes to vision plans. And now life, it's something we hope we don't need, but it's something that we also do need.
Right, we do. And I think COVID taught us that too.
Yes.
There were many people who realized they were without life insurance or they didn't have enough life insurance. And so it's one of the benefits we hope you don't, need to utilize soon, but is definitely a benefit for your family members. Think about the people that are taking care of all those expenses, or the people that you take care of today. And what would they need to continue to be provided for in the event of your passing? The rule of thumb is to think of, do I have 7 times the amount of my annual earnings set aside for life insurance? And so it's a good time to look at that, understand what you have. Again, remember, people are using that money to pay for funeral expenses, maybe tuition for, if you have young kids, think about what college tuition is going to cost in 10 years. And so that's why that kind of rule of thumb is 7 times your annual earnings. Most of the time, your employer will offer you a basic life benefit, but then there are voluntary life benefits that you can purchase above and beyond what your employer might pay to get you to that 7 times your annual earnings. Next is make sure you check your beneficiary, especially during open enrollment. Sarah and Alia and I were talking about this earlier, and I have had the unfortunate conversation of speaking with individuals who thought they should be the beneficiary of the life insurance. Imagine if you had been married, divorced, and now remarried, and your beneficiary is still your former spouse, and the former spouse receives that life insurance benefit instead of your current spouse. I've had those conversations, so it does happen. So please make sure during open enrollment you get that beneficiary updated so that there aren't any surprises.
I always say, even if you're not changing any of your benefit elections, still go in. This is why, and HR would be glad that we threw that little tidbit out.
Next is short-term disability. Again, we don't think, or I still think I'm invincible. And I'm not in my 20s anymore. But short-term disability is a benefit that you should enroll in before it's needed. 1 out of every 5 individuals have a chance of being disabled. And so when you look at that statistic, add 2 more people to this group and one of us will have a disability. And so make sure that you think through that. This is a benefit that replaces your income. So in the event that you're not able to go to work, you're not able to receive that income, this provides that income. But you can't wait until you need it because there's a pre-existing condition limitation. A lot of people fall into that maybe for maternity. When they oh, I'm pregnant, so now I need short-term disability. There's a 12-month pre-existing clause, so you need to make sure you enroll in that now.
So family planning, if you're considering that, make sure you enroll before you actually are pregnant. That is key.
Yep. And then also ask about your elimination period. Think about your PTO. Typically, short-term disability, depending on whether it's health related or accident related, you typically have a period of before you're actually receiving that disability payment. That typically is 8 to 15 days. So think about PTO and how you may want to use PTO to bridge that gap so that, again, you're not going to 2 weeks without an income or a paycheck coming in the door.
And so similar terms is really LTD that really kicks in after the fact.
Correct. So if you have a longer disability, think about a car accident, think about maybe a cancer diagnosis where you are, you need to be disabled longer and still not able to receive income. They say 1 in 4 20-year-olds, believe it or not, will be disabled before the age of 67. So that's a statistic that hits you in the face. And again, we saw a lot of that during COVID where people didn't have long-term disability and they didn't have income to support their family. So please make sure that you consider that during your open enrollment to help protect your family later down the road.
And if you're younger, it really is now is the time to purchase
Yes.
it. Not waiting until we're older and it's more expensive. We really want it now.
Yep.
So
You're not invincible.
you are not invincible.
I'm not. And it also know when your long-term disability kicks in. Again, it's typically right after short-term, but make sure that you plan about 2 weeks ahead of time to fill out all the paperwork so that you don't go 2 weeks without a long-term disability payment. That'll help you.
So speaking about extra payment, my next 3 really go together, and it's talking about what are these extra voluntary products that are oftentimes available. So make sure you're checking your benefits. Some of these even are newer to the market. So I want to highlight these real quickly, but they're lump sum payments. And so critical illness, the tip here is keep your current health in mind, but also your family's history in mind. So critical illness actually pays out a lump sum based off of your actual diagnosis. So if you have a family history of breast cancer, that puts you more vulnerable for a risk of having breast cancer as well. Maybe you should take advantage of this because if you get diagnosed with an illness, you're gonna get that lump sum payment that you can use for whatever, maybe to offset some of those costs, maybe to go towards your health treatment. It's your funding. The next one is similar, it's hospital indemnity, but this it's a lump sum for each day you're actually in a hospital. Mm-hmm. So my tip here is if you are pregnant, you know you're going to be pregnant, you're going to be, you wanna focus on getting this maybe because it covers not only you, but also your dependent that's in the hospital. And so I know one of my coworkers said, I got over $1,000 when I gave birth just for the days that I was hospitalized as well as her daughter. So this is a great benefit that I encourage you guys to look into. And the last one that talks about lump sum payments is accident insurance. I know growing up as an athlete, my mom was always terrified of those concussions or broken bones. If that's you guys, you have very active kids that are prone to injuries, maybe consider accident insurance because it's a lump sum payment based off that broken bone, a concussion, everything you think about when it comes to accidents. So this helps us, Leah and I were in a conversation today with a benefits expert that talked about 1 in 6 Hoosiers are actually in medical debt, just medical debt.
Yeah.
And that debt, she said the average was only $700 that was going to collection. So these lump sum payments would prevent that from happening. And my 30th tip, thank you guys for hanging in there, is pet insurance, because why not end on a really happy note? Pet insurance, if you have those fluffy friends, I say make sure that you take advantage of this when you get your new furry friends and not after they already have an illness, because unlike health insurance, pet insurance does discriminate. So make sure that right when you purchase that pet, if you know that that breed has certain health conditions later down the line, now would be the time to get that insurance. So rather than paying those large lump sum amounts, it's actually spreading out that premium over the course of that puppy or cat's entirety of life. So there you go. We got through so fast. 30 tips for open enrollment. We hope you guys enjoyed that fun twist on wellness. And of course, if you have any questions, make sure to reach out directly to your benefits experts right here at Apex Benefits. We'll see you next month.
Thanks, guys.